today I was coming to see if I could perform a head-to-toe assessment on you. Would that be okay?
Yes.
Okay, I'm going to wash my hands and I'm going to provide privacy. Okay. Now, today I'm going to do a head-to-toe assessment on your head, your eyes, your ears, and your nose. Your thoracic area, your carotid area, your legs, and your feet. Can you tell me what today's date is?
Yes. October the 25th.
Okay. Can you tell me when your birthday is?
9/2/48.
Okay. Can you tell me who's our president?
Trump.
Something wrong? Okay. I'm gonna say 3 words, and can you repeat them after me?
Yes.
Okay. Door.
Door.
Shoe.
Shoe.
Table.
Table.
Now, at the end of the assessment, I need you to repeat that, okay? Now, I'm gonna take a look at your head to see if there are any scars or any lesions in your head. Have you had any surgeries?
No.
Have you had any trauma to your head?
No.
Have you had any drainage, any headaches,
No.
any swelling?
No.
Okay, her hair appears to be fine. There's no scars, any lesions in her hair. Her hair distribution is fine. Her color, her texture is fine. Now, I'm going to check your ears. Have you had any drainage in your ears?
No, ma'am.
Have you had any surgeries?
No.
Have you had any trauma to your ears?
No, I haven't.
Okay, now I'm going to perform a whisper test on you. Could you please close one ear, please? Okay, I'm going to repeat a word. Could you repeat it after me?
Okay.
99.
99.
Could you close that ear?
99.
Okay, good job. Now, I'm going to check your eyes. Now I'm going to ask you a few eye questions, okay? Have you had any eye surgeries?
No.
Are your eyes bothering you?
Just a little blurry.
Okay, any dizziness?
No.
Any trauma to your eyes?
No.
Okay, I'm going to perform a bleep test on you. Okay, could you please occlude one eye for me? Let me know when you see my hand. This is the Perla test.
I see it. I see it. I see it.
Okay, close the other eye. Let me know when you see my hand.
I see it.
Okay.
I see it.
Okay.
I see it.
Okay.
I see it.
Okay, now I need you to follow this pin light for me. Okay. Good. Okay, so her eyes appear to be symmetrical with one another. She doesn't have any eye problems. Her eyes seems to be fine. Let me check your pupils. Okay. Good. Okay, now, are your sinuses swollen?
Not to my knowledge.
Do you have sinus problems?
Yeah.
Okay. Can you tell me the last time you took any medication dealing with your sinuses?
Last night.
Okay. So let's check your nose now, okay? Could you please look up for me so I can look in your nose? Her nose appears to be pink. Okay. Do you have any problems with your nose? Any breathing? Any difficulty breathing?
Just a little stuffiness sometimes.
Okay. Any swelling? Any drainage? Anything like that?
No.
Okay. Could you please close one nostril for me and sniff? Okay. Close the other nostril for me and sniff. Okay. Good job. Now, I'm going to see if you could clench your teeth for me. Okay. Could you smile for me? Could you go like this? Okay, good job. Now I'm going to look in your mouth. Open. Say ah. Move your tongue. Okay. Her tonsils appear to be close together. Her tonsils are present. They are not swollen. Now, could you tell me, have you had any problems in your mouth? Any difficulty swallowing? Any difficulty chewing?
No, no.
Okay. Do you have any problems with breathing, through your mouth or anything like that?
No, I don't.
Okay. Now I'm going to check to see if your trachea is midline. Okay. Her trachea appears to be midline. Now I'm going to check to see if your thyroid is swollen or is it present. Could you swallow for me? Okay. Her thyroid seems to be fine. Now I'm going to check for JVD. Could you look that way for me? Okay. Could you look that way for me? Okay. Her vein seems to be in place. It's no swelling, no JVD, no distension, nothing like that. Now I'm going to check your carotid pulse, okay?
Mm-hmm.
Her carotid pulse is a +2 on that side. On this side, it's a +2. Good. Okay. Now I'm going to check to see if your other pulses are good, or we can just move on to the next step, which is your lymph node.
Mm-hmm.
I'm going to check this lymph node right here, the one behind her ear, and the one right here. Her lymph nodes appear to be fine. Okay, now let's check to see if I can listen to your carotid pulse on my bell. Okay. Okay. Her carotid pulse is present. Now, I'm gonna do your chest now. I'm gonna ask you a couple chest questions, okay? Could you please tell me, have you had any surgeries in your chest?
No.
Any problems breathing in and out, anything like that?
No.
Okay. Have you smoked cigarettes before?
Yes.
Okay. How long?
25 years ago.
Okay. How many times a day?
I don't know. I smoke about a pack a day and a half.
Okay. Now I'm going to ask you, have you had any surgeries on your chest?
No, no surgery.
Okay. Her chest appears to be regular shaped. She doesn't have a barrel chest shape. Now, I'm going to check the back of her thoracic area. 1, 2, 3, 4, 5, 6, 7, 8, 9. Okay. Now I'm going to do the 99 test. Please repeat after me when I say 99. 99,
99,
99,
99,
99,
99,
99,
99,
99.
99.
Okay. Could you breathe in and out for me? Okay. Do it one more time. I'm checking to see if her back is symmetrical. So yes, her back appears to be symmetrical. Now, I'm going to ask you a couple questions about your cardiac area. Do you have any chest pain?
No.
Okay. Could you put your legs out for me? Could you flex your legs? Okay. Now, have you had any swelling in your feet?
No.
Okay, now I'm going to check in her legs for capillary refill. Okay. Okay. Now, I'm going to check your arms, okay? I'm going to check the temperature. Now I'm going to check her fingers for capillary refill. Okay. Could you stand up for me? I'm going to check her popliteal pulse. Okay. Now I'm going to check her dorsopedius pulse. Okay. Both of her pulses are fine. They both are a +2. Now, could you take a seat for me? Now, I'm going to check your radial pulse and your brachial pulse. Can I see your arm? Okay. +3. +3. Now, I'm going to check your intercostal space, okay? We're going to do the 8 to me. This is the second intercostal space, the aortic. This is the right sternal border, second intercostal space. The left sternal border, the pneumatic. The third intercostal space, the left sternal border. The fourth sternum, the tricuspid. The fifth left sternum is the mitral, the PMI, the point of maximum impulse. Now I'm going to turn the bell to listen to the apical pulse. Okay, now we're going to take a skin test. Could you take your arms out? I'm going to do a skin turgor to check for dehydration. She seems to be slightly dehydrated, but nothing major. Okay, we're going to do a little range of motion. Go like this. Okay. Flex your arms back and forth. Turn to the side. Flex them back and forth. Okay. Now I'm going to grip your hands. Don't let me pull you. Don't let me pull you. Okay? I'm going to push. Don't let me push you. Don't let me push you. Okay? Now I'm going to check your abdomen to see if there are any scars, swelling, tumors. She has 4 quadrants, a right upper quadrant, a left upper quadrant, a right lower quadrant, and a left upper quadrant. I'm going to check the right upper quadrant first. Yes, her bowel sounds are present. I will hold there for 5 minutes if I don't hear anything. Okay, now I'm going to check to listen to see if you have any what they call is Tiffany. It's where to see if your bowels are fine. It's usually a hollow sound. So I'm going to percuss. Okay, now I'm going to palpate her bowels to see if they're in the area that they need to be. So it's going to be a deep palpation and a light palpation. So now we're going to palpate the light. Then we're going to do a deep to see if any organs are on the border, if they're swollen, if they're fine, or if they're not okay. Okay, now we're going to check the temperatures of your legs. Could you put your legs out for me? Okay. Now, do you have any pain or discomfort in your legs?
No.
Okay. Have you had any surgeries on your legs?
No, none.
Okay. Do you have any trouble walking?
No.
Okay. Could you stand up for me? Could you walk that way in a straight line? Okay. Walk back this way. Okay. Could you take a seat for me? Now, could you repeat back the 3 words that I told you?
Table,
Yep.
door,
Yep.
uh, I'm gonna be.
Okay. Thank you. I'm finishing my head to toe assessment. Thank you so much. I'm going to wash my hands again. Thank you. If you have any questions, let me know. Have a good day, okay?
All right, thank you.